Good afternoon, everyone, and welcome to today's COVID-19 update. Bonjour tout le monde et bienvenue à cette mise à jour sur le COVID-19 au Nouveau-Brunswick. Les porte-paroles aujourd'hui sont les suivants. La médecin hygiéniste en chef, le Dr. Jennifer Russell. Le ministre de l'Éducation et du Développement de la Petite Enfance, Dominic Cardy, et le Premier ministre Blaine Higgs. Speaking on behalf of the province today in the following order are Dr. Jennifer Russell, the province's Chief Medical Officer of Health. The Honorable Dominic Cardy, Minister of Education and Early Childhood Development, and the Honorable Blaine Higgs, Premier of New Brunswick. Dr. Russell.
Bon après-midi à toutes et à tous. Good afternoon, everyone. Comme bien d'autres provinces canadiennes, le Nouveau-Brunswick est présentement aux prises avec une forte augmentation du nombre d'infections à la COVID-19. Santé publique annonce que 122 nouveaux cas ont été confirmés pendant la fin de semaine. Il y a présentement 11 citoyens du Nouveau-Brunswick à l'hôpital après avoir contracté la COVID-19, dont 9 aux soins intensifs. Ce nombre est le plus élevé que nous avons vu depuis des mois. Like many other Canadian provinces, New Brunswick is experiencing a spike in new COVID-19 infections. Over the weekend, Public Health has confirmed 122 new cases. We also have 11 New Brunswickers in hospital, including 9 under intensive care. That's more than we have seen in many months. Today, we have 229 active cases of COVID-19 in New Brunswick in every corner of the province. Again, it has been many months since we have seen this number of active cases. But this fourth wave of infection is different than what we saw during the third wave last winter and spring. Il y a présentement une épidémie au sein de la population non vaccinée, soit les personnes qui ont choisi de ne se pas faire vacciner et les personnes qui ne sont pas encore admissibles à recevoir le vaccin. La très grande majorité des nouvelles infections sont des personnes qui ne sont pas encore pleinement vaccinées contre la COVID-19. Les adultes qui ne sont pas entièrement vaccinés contractent le virus et le transmettent aux autres. We are experiencing an epidemic among the unvaccinated, those who have chosen to remain unvaccinated, as well as those not eligible for vaccine. The vast majority of new infections are happening among those who are not yet fully protected against the COVID-19 virus. Adults who are not fully vaccinated are catching the virus and passing it on to others. When young children are infected, it is most often due to contact with a family member or a household member who is not vaccinated. And I say this without malice or without judgment, but this is what we're seeing in terms of transmission. So I'm not casting blame on anyone. There are many, many reasons and factors involved in people's approach to vaccination, but here are the facts. If you are not vaccinated, you are risking your health and the well-being, your health and well-being in this ongoing pandemic. You are also putting at risk the health of our children and their ability to stay in school. Obviously, when there are outbreaks in schools, then that affects their learning, as well as other vulnerable New Brunswickers, including our ability to continue to offer healthcare services with respect to ICU services if the numbers are to get too high. Vous mettez également en danger la santé de nos enfants, ainsi que celle d'autres personnes vulnérables du Nouveau-Brunswick. Nous avons maintenant des moyens de maîtriser cette augmentation de cas qui n'était pas à notre entière disposition pendant la troisième vague de la pandémie de COVID-19. We have the means to bring the surge under control, which were not widely available during the third wave of COVID-19. We have safe, effective, and proven vaccines which limit the worst effects of this disease. We know that about 95% of people who are fully vaccinated will not suffer severe effects and will not require hospitalization. These vaccines are free and available to everyone in every community across the province, and we need every New Brunswicker to get vaccinated. It's not too late. We are still vaccinating people every single day, including first doses. In fact, my son was taking one of his friends today to get vaccinated with his first dose. So every adult, everybody who's eligible to get vaccinated should be vaccinated, and teenagers rather as well. So we need to do this to protect those who cannot be vaccinated, especially our young children. And that's the cocooning effect. So the higher the rates of vaccination in the community, the more protection the schools are provided with. Given the number of new cases reported by Public Health over the weekend, I won't read the full list here today. It is in our press release, and it will be available on the GNB dashboard. And while there are active cases in every region of the province, there are particular regions where the virus is spreading more quickly. Zone 1, which is the Moncton and southeastern New Brunswick area, has been at the center of this latest wave, and there are 71 active cases in this region. And my understanding is it's the UK variant that's prominent there at the moment, but the rest of the province, it is the Delta variant at this time. We don't have any cases of Mu at this time. Zone 5, which is the Campbellton-Restigouche area, has 61 active cases, 48 of which were reported over this past weekend. There are 43 active cases in Zone 3 and 29 in Zone 4, and we are seeing a growth in cases in the Upper St. John River Valley, where those zones meet. There are also 13 active cases in the Miramichi zone, 8 in the Bathurst-Acadian Peninsula area, and 2 in the St. John zone. Public health is very concerned, as am I, with the outbreak at the Harvest House shelter in Moncton. We did have meetings over the weekend about this particular outbreak. There are now 24 active cases at this facility, and a second round of testing will take place today. My understanding is the prompt team has been working really closely with that organization, and it's going as well as it absolutely can right now, so that is encouraging. Il y a présentement 24 cas actifs dans cet établissement et une deuxième ronde de tests de dépistage est prévue aujourd'hui. There have been a significant number of cases reported among school children across the province, and obviously as a parent, I have children, and in fact one of their schools was affected today, and so I can understand what kind of angst and anxiety that can cause. So we want to make sure that we give clear direction and that everybody understands what is going on in each of these situations. And Minister Cardy will have more to say on the measures being taken to protect students and staff. It is important to note that at this point, these infections happened prior to the start of the school year. And given the incubation period of the virus, which can be up to 2 weeks, cases we are seeing among New Brunswickers today started before Labor Day. In terms of that transmission, we still have yet to see any student-to-student transmission within the school setting. Our contact tracing shows that many of these infections occurred because children were in contact with a family member or a household member that was not fully vaccinated. New Brunswick has had so much success dealing with COVID-19 over the last 18 months. I'm very, very proud of the work that all New Brunswickers have done up until this point in time. We have worked so hard to get our province to the green phase, and we really cherish the freedoms that has brought us. But now we are facing this new challenge, and it is one that we can overcome, and I say that with confidence because we've done it before. So if you are vaccinated, please continue to take the common sense precautions that will slow the spread of the virus. We are still encouraging that it is your choice to wear a mask in certain situations. Obviously, in the school outbreaks, there will be some messages that differ. And obviously, hand hygiene, physical distancing, these are all things that you can still continue to do. If you are not vaccinated, please don't wait and book your appointment today. Chaque personne qui peut recevoir le vaccin doit se faire immuniser. C'est ainsi que nous pourrons protéger les personnes qui ne peuvent pas recevoir le vaccin pour le moment. C'est ainsi que nous pourrons renverser cette récente tendance. It's how we will turn the tide of this latest surge. Thank you very much.
Good afternoon, everyone. Bon après-midi, bienvenue. So since Thursday evening, we've had positive cases of COVID-19 confirmed in 11 schools across our province, 3 childcare facilities across zones 1, 3, and 5. So in zone 5, those include the Lord Beaverbrook School, the Galion des Appalaches, Campbellton Middle School, Sugarloaf Senior High School, Dalhousie Regional High School, Polyvalente Roland Pepin, We Care Daycare, We Care 2 Early Learning Center, and Youth in Action Daycare. These facilities, these schools have all had positive cases of COVID-19 confirmed. In Zone 1, West Riverview Elementary School, Riverview High School, and Moncton High School have all been impacted by positive cases of COVID-19. Finally, in Zone 3, Donald Fraser Memorial School and École Sainte-Anne have also had positive cases confirmed. Je sais que les familles se sentent anxieuses en ce moment, en particulier celles qui ont des enfants de moins de 12 ans qui ne peuvent pas encore être vaccinés. Nous savions qu'il y aura des cas dans les écoles tout au long de l'année à venir et c'est pourquoi nous continuerons à suivre nos plans de gestion d'éclosion. L'année dernière, ces processus ont permis à nos élèves d'apprendre tout au long de l'année avec un minimum de perturbation de l'apprentissage, un nombre limité de cas dans les écoles et très peu de transmission dans les écoles. At this time, our colleagues at Public Health have advised that most of the impacts we've seen on schools throughout the past few days are the results of activities within the larger community over the Labor Day long weekend. Like last year, what is currently happening in schools is a reflection of the situation in our communities. And that's why it is so important with safe and effective vaccines available for everyone who is eligible to get vaccinated as soon as possible, to listen to public health advice, and to make informed and responsible decisions about how you can help to reduce the spread of COVID-19 in your community. We've also always said that when it comes to our plans to manage COVID-19 in our schools, that we're going to be flexible and adapt them as needed to respond to new information and evolving situations. So we've been working closely with Public Health over the course of the weekend to adapt our guidelines based on this evolving situation, and we're going to continue to do that throughout the coming year. So based on our conversations with Public Health, effective tomorrow, students of all ages in all schools across New Brunswick must wear a mask in school and while on school buses. Masks may be removed when students are eating, drinking, or engaged in sports or physical education. These measures are going to be in place for the next 2 weeks at all schools across the province and then reassessed by the week of September 27th. We're also adding layers of protection to schools and childcare facilities in the Campbellton and Dalhousie region that, as we can see, has been particularly hard hit by this recent outbreak. And those rules are going to apply to the following schools, regardless of whether a case has been confirmed at that school. At Polyvalente Roland-Pepin, L.E. Rainsborough School, Le Galion des Appalaches, Lord Beaverbrook Elementary School, La Mosaïque du Nord, Campbellton Middle School, the École Communautaire Académies Notre-Dame, Dalhousie Regional High School, École aux 80, and Sugarloaf Senior High School. For the next 2 weeks, students will wear masks throughout the day in both common areas and within the classroom. Schools will do all they can to reduce the amount of contact between groups of students in different classrooms. And schools will not start any interscholastic, extracurricular, or intramural activities that are not already underway in those schools. Teachers who are fully vaccinated will be able to remove their masks in the classroom for instructional purposes. Et les mêmes mesures s'appliqueront aux garderies de la région, notamment ceux qui accueillent des élèves de l'une des 10 écoles mentionnées précédemment. En outre, le personnel de ces établissements qui n'est pas entièrement vacciné devra porter des masques tout au long de la journée. De plus, nous encourageons les garderies à se rapprocher de leur chambre de commerce locale pour participer à des programmes de tests rapides destinés aux petites et moyennes entreprises. We're going to be continuing to work with Public Health to monitor the situation closely in the coming weeks and keep families informed. And I again urge anyone who is eligible to get fully vaccinated to help keep our kids healthy and safe, which helps to keep our communities healthy and safe. As we did last year, we're going to be keeping our families informed of impacts on schools and while meeting government's obligations under the Personal Health Information and Privacy and Access Act. S'il y a un cas positif ou une exposition possible, si c'est confirmé dans une école ou dans une garderie, les familles et la communauté scolaire en seront directement informées. Sinon, la bonne nouvelle est aucune nouvelle. Après la détection d'un cas qui a des répercussions sur les élèves resteront à la maison et l'école va transitionner à l'apprentissage à domicile selon l'âge. Sinon, Ils prendront une journée opérationnelle afin de permettre le dépistage des contacts. Si les familles rencontrent des difficultés pour se connecter à l'apprentissage à distance, nous disposons d'un centre d'appel pour vous aider. En composant le 1-833-453-1140, le personnel est prêt à répondre à vos questions sur Office 365, Teams ou Wi-Fi. So I want to thank all the school and district, departmental, and public health staff for their tireless efforts over the course of this weekend to protect our students and staff. I know that this is a quick turnaround in our policies, but again, this is how we have gotten through COVID to this stage, quickly replying to changing situations, opening up, having more freedom whenever possible, tighter rules, clamping down when it's required to keep us all safe. All of those folks are doing their best and doing amazing work to keep our schools healthy and safe while minimizing the impacts on learning, because of course we have to remember that learning and keeping our schools open is the whole point of the public education system. And so we want our students to be able to maintain their routines and ensure that their physical and mental and social needs are met, as well as the health requirements that are all at the top of our minds. So I'll be here to keep you informed in the coming weeks, along with the Premier, Dr. Russell, and others. And until then, please get vaccinated. Dr. Russell is kind in saying she does not judge. At some point, we have to call this pandemic what it is, a pandemic of the unvaccinated, spread by the unvaccinated to innocent others who have done their part. There's a tiny number of people who cannot get vaccinated. For everyone else, please step up for your province, for your family, and for yourselves. Merci beaucoup.
Good afternoon. Bonjour. Over the last few days, we have seen a sharp increase in the number of COVID-19 cases in New Brunswick. Depuis que nous sommes passés à la phase verte à la fin de juillet, nous savions que le nombre de cas allait probablement augmenter. Et c'est exactement ce qui est arrivé. Cette situation n'est donc pas totalement inattendue. Le nombre de cas était relativement constant jusqu'à aujourd'hui. Our goal has always been to live with COVID-19 while ensuring we have capacity in our hospitals. And until now, that has not been a serious concern. Over the weekend, the number of hospitalizations rose. There are now 11 New Brunswickers in a hospital, with 9 in ICU. Since July 1st, there have been 698 confirmed cases of COVID-19 in New Brunswick. Of those, 613, or 88%, were people who were not fully vaccinated. While we are able to address the current level of hospitalizations, we do not want to wait until we reach a critical state to introduce changes. Because of this, Cabinet will be meeting later this afternoon to discuss not only our current situation, and we'll discuss that with public health, but determine whether new requirements are needed to ensure our hospitals do not become overwhelmed, that our schools will continue to operate as normally as possible, and that we can keep New Brunswick in green. I expect to be able to tell you more about any decisions that are made on Wednesday of this week. While I do not yet know what specific measures may be introduced, I can tell you that everything is on the table. This includes the possibility of requiring proof of vaccination when accessing non-essential services, businesses, and activities. We may also include a requirement for anyone entering the province to register their travel. Nous allons travailler avec la santé publique et nous allons écouter ses conseils pour déterminer les mesures qui seront les plus efficaces pour limiter le nombre de hospitalisations et pour encourager un plus grand nombre de personnes à se faire vacciner. As Dr. Russell has already said, the vaccine really is a key to getting through this current rise in cases and moving beyond the pandemic. While it is possible to get COVID-19 when fully vaccinated, these are the minority of cases, and they are typically not severe cases that require hospitalization. We are seeing the vast majority of cases in people who have not been fully vaccinated, including, unfortunately, in children under 12 who are not yet eligible to receive the vaccine. Our vaccination numbers are still rising, albeit slowly, As of today, we are 76.9% of eligible New Brunswickers being fully vaccinated, and 85.6% have received their first dose. Mais ces chiffres n'augmentent pas aussi rapidement qu'on le voudrait. Notre gouvernement a fait tout ce que peut pour rendre le vaccin disponible pour tous les gens de Nouveau-Brunswick admissibles. Et nous allons continuer de le faire. Vaccination clinics by Horizon and Vitality Health Networks continue to offer appointments across this province. Pharmacists are also continuing to administer vaccines and to follow up with those individuals who have maybe received their first dose but not yet booked their second. Mobile and walk-in clinics are regularly available in communities throughout our province. At this time, there is simply no excuse for anyone not to be fully vaccinated. If you haven't prioritized getting your shot because you do not feel you're personally at risk of getting sick, I ask you to do it to protect your community, people who may be immunocompromised, and children who cannot make the choice to get vaccinated. Nous sommes encore dans la phase verte et nous voulons y rester. Tout le monde a travaillé fort pour arriver à cette étape. I want to thank everyone who has already done their part by getting vaccinated. And I want to assure you that we will continue to do everything we can to allow you to continue to live life normally in our province because you have done your part. I appreciate that the majority of New Brunswickers have done the right thing and of their own volition to protect the greater good. It appears those who are still unvaccinated may need some additional motivation. And that's what I will be discussing with Cabinet and Public Health later today. In the meantime, before I return with an update in the next couple of days, I urge you to book a vaccination appointment if you have not already done so. Thank you. Merci.
Thank you, Premier, Minister Cardy, Dr. Russell. Merci beaucoup, Monsieur le Premier ministre, Ministre Cardy et Dr. Russell. Nous allons maintenant procéder aux questions des journalistes. Vous avez le droit de poser votre question dans la langue de votre choix. Chaque journaliste aura une question. Voulez-vous assurer de désactiver le son de vos micros? Ladies and gentlemen, we'll now proceed with questions from members of the media. Each reporter will have one question. You have the right to pose your question in the official language of your choice. Please ensure your microphones are placed on mute. And we're going to start with Laura Brown.
Premier, I'm wondering if you've spoken to your Atlantic counterparts at this point in time, or have you informed them of the situation in New Brunswick, or are you including them in the conversation about further restrictions?
Well, certainly not. I haven't spoken to them in relation to this following weekend's results. We've reacted quickly to what we have learned over this past weekend. We had meetings internally yesterday and then planned for this release today. So I haven't had any conversation additionally with my colleagues. However, after a cabinet tonight and where we go in the next phase, I would anticipate there will be some conversation, especially if things change around the borders. At this point, I'm not sure what's going to happen there. But yeah, we have a good relationship with all the other three premiers in Atlantic Canada, and we'll continue to keep informed of each other's activities.
Thank you, Premier. Thank you, Ms. Brown. Travis Fortnum, Global TV.
Hey, I'm not sure who wants to answer my question. Actually, Premier Higgs, this meeting today, the possible incentivization for people who are unvaccinated to get vaccinated, is this sort of a last stop before possibly reintroducing an emergency order?
Well, I wouldn't go so far as to say we're at that stage at all. I mean, we said we'd be triggered by an increase in hospitalizations and not so much an increase in active counts, although this weekend was significant for sure. But the level of hospitalizations going up was always our trigger. So given that, the next phase is how do we avoid contact of the unvaccinated with the vaccinated or with people who can't be vaccinated, as we've talked about with schools. And there are ways to do that, which we've seen that's been acted in other provinces. And that involves looking at the vaccination identification and then allowing businesses to make a choice. And when businesses or functions at gatherings, to make a choice whether unvaccinated should attend. I think that is one of the considerations. I don't think we're at a point that an emergency order is back on the table at all, because we know the problem, we know the solution. We just have to get people to follow the solution and be part of it. And that's a different phase, a different situation than we had back certainly 18 months or 12 months ago.
Thank you, Premier. Thank you, Mr. Fortnum. Andrew Waugh, Brunswick News.
Yeah, hi. I'd like to get a breakdown of how many, children in the 12 and under category are among these new cases. And Minister Cardy, when you say this is becoming, and Dr. Russell, when you say this is becoming a pandemic of the unvaccinated, what about these kids that can't get vaccinated? Are you lumping them in together?
So if I can, Dr. Russell, if I could ask you perhaps to go through the numbers, because that's in your shop, and then I can handle the other part of the question.
Yeah, my understanding is we've addressed this before in the sense that our breakdown is under the age of 19, and that entails all of that age group, is my understanding. But I can come back to that and just confirm.
And in terms of the under 12s, they obviously are included in the unvaccinated right now because they aren't even eligible. We talk about eligible numbers, though, which is where most of the stats that we're sharing publicly, that's about those who are eligible to get the shot. We do have those thousands of young people who aren't. There was good news over the last few days that Pfizer BioNTech look like they're going to be getting approval for the 5 to 12 age group sometime in the next couple of weeks, which is fantastic news. But in the meantime, we have sad cases such as the one I heard this weekend of unvaccinated parents spreading COVID-19 to their kids. And it's this sort of horror that we have to do our best to avoid. And I would just ask everyone out there who's already had their shot, who maybe looks at the neighbor, the family member who's continuing to refuse to get their shot, go and talk to them. Push on this. This is our last chance to get through this without more damage, as the Premier was just talking about. We don't want to have to go back to emergency orders. The path to the end of COVID-19, the path back to freedom on this is through vaccination. Get your shots.
Thank you, Minister. Dr. Russell would like that to...
Yeah, just to add, we are looking to see if we can get that number for you, Andrew, without breaking confidentiality.
Thank you. Timothy Jakes, Campbellton Tribune.
Yes, my question is either for the Premier or Minister Cardy. Ontario further upgraded school ventilation systems prior to the school year, including installing 20,000 additional standalone high-efficiency particulate air filter units this summer on top of those installed last year. And they said they were relying on the best expert advice, that's a quote, in doing so. So given the measures you just had to announce in Zone 5 schools, do you regret not having done so, particularly given children under 12 can't be vaccinated yet?
If you look at the results of New Brunswick's experience with COVID so far, it ranks as one of the best in the entire world, especially when it comes to schools and the very small number of days lost last year because of the measures we had in place. We've done necessary upgrades to ventilations where we've been able to do that, but we've been relying on a layered approach to COVID protections, including mask wearing and all the other measures that we got used to last year. And this year, we're going further. We're not waiting to try and simply remove COVID-19 particles from the air in a classroom. If we find out there's COVID-19 in a school, we are moving the school online immediately. So that's our intent, is to again be harsher in our fight against this virus than most have been, because that works. As far as other efforts to improve our ventilation system, we've got lots of long-standing issues there with older schools and so on. We're going to keep working with the experts on that inside the department, inside government, and this weekend I asked the team as well to reach out to as many people as possible to make sure we've got the strongest possible structures in place. But when it comes to protecting our schools against COVID, I think we're doing something that no one can argue isn't taking the most serious of measures, which is removing the students and the staff from those schools with one case.
Thank you, Minister. Thank you, Mr. Jakes. Hidil Ibrahim, CBC.
Thank you. This question is for Minister Cardy. You just said that if there's a single case in a school, that school will move to online learning. But there have been some schools that are still open, just some classes closed, like Le Galio de Appalaches in Campbellton. So has something changed? Is this Are people just not listening to the rules, or what's happening there?
No, the only, again, we follow advice from public health in terms of our rules, and our rules are extremely clear that we make sure that we, if we have a single case, that we have the school move online. That has been the policy, and that's that.
Thank you.
Oh,
Tom
okay.
Bateman.
Just to confirm, I'm so sorry. I want to confirm the number with Dr. Russell. Is it 120 or 122? I think you said both in English and French.
My understanding is it's 122.
Yep, 122.
Thank you. Thank you.
It's one calendar day as well. So if a school has a case or an exposure on a Friday, for example, that gives us 2 full days when the school is already closed. So that's when we do all that work to do the deep cleaning and so on. So that would be, that's the only time when you wouldn't see a school shut on a normal day is if it happens to fall on a weekend for obvious reasons.
Thank you. Tom Bateman, Brunswick News.
Oh, hi there. I can't help but compare how New Brunswick is responding to this increase in cases with how PEI didn't hesitate to shut down nearly all the schools in the Charlottetown region for a total of 6 cases they detected over the weekend. We know this is Delta or Alpha variant fueled. We have another holiday coming up, Thanksgiving, in a few weeks. Why aren't we taking more widespread or serious measures today and not waiting until Wednesday at the earliest to tighten up? Thank you.
Answer that quite well. First off, Delta and Alpha are very, very different beasts. The Delta variant is the one that we've been afraid of seeing arrive in the province. It's here and it's spreading, and we're taking it very seriously. We're not just shutting down schools. We're shutting down schools immediately on one case, and we'll shut them down as long as public health tells us that there's a risk. Our flexible approach to this has been what allowed us last year to have dozens of schools experience single or 1 or 2 or 3 sometimes cases. But then we were able to push it back out again. And that's going to be the intent this year. And if we see that we need to do more, we will do more. I don't think this government has ever hesitated from taking radical action in the face of COVID-19, and we won't hesitate this year.
Bateman, Sarah Derry, Radio-Canada.
Oui, c'est pour le ministre Cardy. Vous avez déjà dit être en faveur de la vaccination obligatoire pour tous les élèves qui étaient admissibles dans la province. Avec les cas dans les écoles en ce moment, est-ce que ça serait le temps de mettre en vigueur cette mesure maintenant?
Je pense que mon perspective sur ça est assez claire. Que oui, la vaccination mandatoire que maintenant est en place pour les fonctionnaires, pour les enseignantes, pour les aides enseignantes, les gens qui travaillent, tous les adultes qui travaillent dans le système. Et c'est clair aussi avec la faiblesse dans les nombres de jeunes qui sont vaccinés dans le groupe entre 12 et 18, qu'on a encore une question adressée là. Mais aujourd'hui, il n'y a pas de vaccins qui sont même légaux pour administrer aux jeunes. Alors ça, c'est une question qu'on a besoin de répondre aussitôt qu'on a un vaccin qui est disponible pour tous les jeunes de notre province dans les semaines qui arrivent. Et j'ai hâte de participer dans cette conversation.
Merci beaucoup. Simon Delatte, l'Acadie Nouvelle.
Oui, bonjour. C'est une question pour peut-être la docteure Russell. J'aimerais savoir si les taux de vaccination ont augmenté, notamment parmi les fonctionnaires, parmi les travailleurs de santé, par exemple, depuis cette exigence de vaccination. Quels effets vous avez vus sur les taux de vaccination?
Je n'ai pas les nombres exacts de taux de vaccination dans ces individuels, mais je sais que au niveau les ressources humaines de chaque organisme qui participe dans cette directive, c'est eux qui auront des informations sur les taux de vaccination. Mais si c'est possible d'en avoir, je vais essayer de les produire.
Merci beaucoup, Dr. David Coach, Brunswick News.
Hi, for Dr. Russell, since I only have one question, I thought I'd just ask, could you provide some more information about the Harvest House outbreak, such as the vaccination rate of residents, if it's known, whether any of them are hospitalized now, whether any of them are in ICU, and what about the staff and employee breakdown?
I guess in a general sense, all the work that's been done over the weekend has allowed things to progress in a positive way. So that I can say in terms of the updates I received over the course of the weekend and this morning were that all the work that needed to be done to protect the population in that particular place has been done. And they also did some testing at the other location that they were concerned about. House of the Nazarene, I believe it's called. So, and I do understand that the vaccination rates are low, but again, it is a population that is relatively transient. So early on when we've tried to address that with vulnerable populations, it is something that is on our radar, and we continue to address that. I don't have the status of anybody with respect to requiring hospitalization or ICU admission. I'm not aware that any of them have been hospitalized, but I can get back to you with that information.
Thank you. Vicky Hogarth, CHCO TV.
Thank you, Bruce. Minister Cardy, only 61% of New Brunswickers aged 12 to 19 have had both doses. Now that the more portable Moderna vaccine has been approved for kids over 12 and up, will you consider doing more pop-up vaccination clinics in high schools to get more students vaccinated? And also, with regards to their parents, the 20 to 40-year-old age group has a fairly low vaccination number too. So what measures do you think would convince more parents to get vaccinated at this point?
Well, with the 12 to 19 age groups and those pop-up clinics and ideas like that, absolutely. We're working with public health to have as many opportunities as possible for folks in that age group. And then once we've got the younger kids open for vaccines as well, to make it as easy as possible for the students and for their families to get them vaccinated. And when it comes to the adults, yeah, I followed this file for many, many years, and I don't know the answer to that question. We've seen a year and a half of a pandemic ravaging the world and killing millions of people. We've seen clear evidence of the dangers of COVID-19. We've seen people in the news, journalists and others who spread misinformation about COVID themselves get sick and die from the disease, sometimes writing out their last note saying they wish they got vaccinated because they can no longer speak because they're on a ventilator. All I can do is ask them, beg them to look at the science, to remember that things that they see on the internet are not necessarily going to be the truth, and to look to try and see if they can find it within themselves to open their hearts and minds to the knowledge and expertise that people who have spent decades of their lives working to try and protect us have brought to this world with the vaccines, the science around it. And I'd ask them to do that. And I think that's all we can do, because at this point, at some point, we have to say that there's going to be a response by the vaccinated, by the enormous majority who've done the right thing, and that there's going to be a decline in tolerance for those who, for whatever reasons, endanger the lives of the people around them. And that's about where I am right now.
Dr. Russell, you'd like to add something?
Yeah, just with respect to vaccinations in schools, the RHAs are actually beginning some of those this weekend, and clinics are being set up in all zones by public health.
Thank you. Tim Roselle, Global TV.
Thank you, Bruce. My question is for Dr. Russell. Dr. Russell, you said before that influenza cases in the province were basically non-existent or all but eliminated last year because of the pandemic and the restrictions that were in place and all of the cleaning, the enhanced cleaning protocols and things like that. But I was just wondering if you could characterize what public health is thinking about the prospect of having an active flu season this year as COVID-19 numbers continue to climb, and is the healthcare system in the province prepared for that?
Well, the first thing about this year's flu season is we will carry on with our regular vaccination rollout for flu. That has been very effective. I think the issue with last year and the circulation of almost no influenza was really as a result of all of the public health measures. There's no question. So yes, this year there is a relaxation of those measures. However, as you know, we do keep recommending that people do have the choice to continue with many of those. And if you were really happy not having to deal with the flu last year, then that's all the more incentive to continue with those. With respect to the healthcare capacity, obviously that is something that we watch very, very closely. Because we are aware that if the hospitals do fill up with COVID patients, then that means that whatever other types of health services are required for other types of healthcare needs with respect to acute care issues, including things like influenza, then that's a problem as well. And as we've said all along throughout the pandemic, that our healthcare capacity is one of our most precious things that we do have to protect, and all of the things that we do today do impact that, and moving forward that will continue to be a huge priority.
Thank you. Laura Lyle, CTV. As we wait for Laura, I'll go to Derek Haggett, Brunswick News.
Hi there. My question's for Minister Cardy. Minister, there were around 150 to 200 additional janitorial staff hired last year to assist keeping schools clean and sanitized. Now, they weren't brought back this year, but is there any thought of bringing them back? And were there any additional custodians in the affected schools today? Thank you.
So the last half of your last sentence I wasn't quite clear on. I'll go after the other one, and if there was anything else I missed, please come back to me. On the janitorial staff, no. We are keeping and will keep past COVID the extra cleaning measures that are in place, including getting students to be part of that. So that seems like a good life skill apart from helping our schools stay safe during COVID. And that's the intention at this point. That was, as the science around COVID evolved, became increasingly clear that masking and some of the other measures were the most important things we could be doing, next to, of course, vaccination. So that's our intent, is to continue to focus on those measures. And if I missed the second question there, let me know.
Yeah, I was just wondering, was there any additional custodians in any of the affected schools, any of the schools where there were COVID cases today?
We'll be doing the deep cleaning, but that was not one that we hadn't been particularly using the extra staff for that. So that's something we just do anyway from time to time, regardless, during flu seasons and others. So this year we'll be doing it for COVID.
Thank you. Laura Lyle, CTV.
Hi, can you hear me okay?
Perfectly.
So this question is for Dr. Russell. Dr. Russell, I'm wondering if you can tell me, of the active cases that we now have in the province, how many cases are of the Delta variant, how many are circulating in New Brunswick, and how many cases are the UK strain?
So what I have right now, I'm just trying to see if I have the exact breakdown. I guess the general breakdown that I received this morning was that the cases in Zone 1 were mostly Alpha, and the rest of the province was mostly Delta. But there's a little bit of a lag with respect to analyzing that information in terms of when they test for the different strains. So, but as we get more information on the strains, we do make sure that the public is made aware. Oh, I might actually have, again, I have some data, but I don't necessarily have all of it at my fingertips. Oh, sorry, here it is. So I don't have the breakdown of the variants with respect to the active cases currently, other than what I've just told you in a general sense. But what I can tell you is that of all of the 1,058 cases to date, which had been confirmed as a variant of concern, 577 of them were Alpha, 87 were South African, and 22 were the Gamma variant, and 372 were the Delta variant.
Thank you. Mia Urquhart, CBC.
My question is for Dr. Russell. How many of the 11 people in hospital are fully vaccinated, so longer than 2 weeks before infection?
I'm not sure that I have that exact breakdown, but what I can say is that the majority, 86% of all of the cases in total, of the 122 new cases, 86% of these cases are not fully vaccinated. But the ones that are currently in the hospital, I can say in a general sense, the majority of them aren't, but I don't have the exact breakdown. Sorry about that.
Is that something you keep track of?
Well, it's about confidentiality, so I think it's one of those things where if we put it together with all the cases in total, then people's confidentiality is protected. I can just tell you that right now we have 11 cases in hospital and 9 of them are in the ICU.
Thank you. Savannah Odd, Telegraph Journal.
Hi there. As you mentioned, the hospitalizations have obviously gone significantly up. What exact number or threshold, I guess, is there for, bringing back some of these rules to the general population? I guess, do you have projections for when hospitalizations kind of cross over into that range where they're going to affect the system negatively?
Well, maybe I'll start and then I'll turn it over to the Premier to address that. Obviously, we never really wanted to find ourselves in a situation where we had to confront that, because we really knew that the vaccination rollout had the potential to eliminate that risk. And so we are at a point now where it is really imperative, as we see those numbers going up, to make sure that everybody who can get vaccinated does get vaccinated. And again, I know that some of the people in the group that haven't been vaccinated, there are logistics, there's time, there's conversations that haven't been had with a healthcare provider. There are many opportunities to have those conversations with a trusted healthcare provider as your source of information, like pharmacists. For example, you can walk into pretty much any pharmacy in the province and have that conversation. If you have access to a nurse practitioner or a family physician, that's a great place also. Friends and family who can help encourage as well. We also know there have been people with needle phobias. We've been trying to address that as well, to really encompass what are all those barriers and how can we make sure that we reach as many people as possible. I think we're at a critical point in terms of really making sure that everybody understands that we all have a role to play in protecting our healthcare system, and vaccination is the best way to do that.
I guess if I added anything to that, we're not at a point that our levels in hospitals are taxed in any way, but we do know the challenge that's been on our hospitals throughout the pandemic. We know the challenge that's been on our healthcare workers, and we don't want to get in that state. So to try to balance this and react quickly to the needs, but to put out the plea that we can avoid all of this now. 18 months ago we couldn't, but now we can. And so it's a case of, a lot of people have worked really hard to get us to where we are at this point. And let's not lose it now. Let's not say, oh, well, I don't need to do anything. It won't affect me. What we're seeing is, for all of you that said it wouldn't affect you and you weren't vaccinated, you are at risk. But as equally to that, you're risking others. So we have a lot to be proud of in our province, and a lot of people have worked very, very hard to get here. And we need to keep the momentum moving, and we need to ensure that our facilities can continue to operate in a challenging environment, but in one that we can control. And right now, we need everyone's help to continue that control.
But Premier, you say we're not in a place where the hospitals are taxed. What is that place? Like, do we know what that?
My point is only that they are taxed in terms of general. We know the shortage on nurses. We know the challenges we're facing in that regard, and there's been a lot of discussion. So I'm referring directly to the number of hospitalizations that are spread out around the province that are currently there because of COVID. That is my reference. And this is avoidable. And so do we have a number? Well, do we have a hospital that cannot handle any more in ICU at this point? At this point, no, we do not. But could we get there if the trends continue? Yes, we could. Is it avoidable? Yes, it is. And that's the sad part, is it's avoidable. So let's not get there. let's not put our healthcare workers at risk or continue to tax them in a way that is easily avoidable. And that's my point. And it is spread out all over the province. But we want to exercise the right changes in how we manage this, as we've always done, to ensure that we can collectively keep it under control.
Thank you. Miriam Lafontaine, CBC.
Hi, I had a question about the strike votes that are happening among some of the CUPE locals. The CUPE-NB recently said that they were provided incomplete lists of employees by the province. So I wanted to ask if the province is aware of what might have caused the error in the list of employees, and as well, I wanted to check if it's been corrected. And this is to Premier Higgs.
Yes, I am aware in the sense that the lists are provided to the Labour Board upon request. And I think I learned the last request for a list was back in 2019. So I believe that the CUPE were working off an old list from the Labour Board, but we provide them readily. But I think what is equally as surprising is that, you know, these are members that all pay union dues. And I would anticipate that the list of individuals paying union dues would be well understood by CUPE. So that's a bit of a nuance to this story, I would suggest.
Thank you. Pascal Rochnog, Radio-Canada.
Bonjour, ma question est pour le Premier ministre Higgs. Tantôt, vous avez mentionné qu'aujourd'hui, lors de la réunion du cabinet, tout sera sur la table, incluant des preuves de vaccination pour les activités non essentielles, des restrictions aux frontières. Est-ce que le port du masque obligatoire dans les lieux publics intérieurs, est-ce que c'est sur la table? Est-ce que vous allez en discuter lors de la réunion du cabinet aujourd'hui?
Well, certainly we intend to have discussions on all issues when we meet at Cabinet and look at the current information from public health and what we're seeing across the province and what mitigation steps we should take to go forward. So yes, everything will be discussed. That's certainly, we don't want to rule anything out. But I do want to emphasize that, you know, it is important that we respect those that have almost 77% now that have got fully vaccinated, 87 at a first dose, which we assume we would expect that they would get vaccinated sooner for their second dose. And but all items will be discussed as part of our cabinet meetings. That's why we look at all the facts and then decide from there the best steps for our current situation.
Merci, M. Rochnog. Jean-François Boisvert, l'Acadie Nouvelle.
Oui, cette question s'adresserait soit à Mme Russell ou au ministre Cardy. Je voulais savoir si on est surpris peut-être par la vitesse à laquelle la situation a dégénéré aussitôt dans l'année scolaire, à savoir le nombre de cas. Est-ce qu'on est surpris par la vitesse à laquelle c'est allé? Est-ce qu'on était prêt à une telle éclosion si tôt dans l'année scolaire?
Je peux commencer, puis peut-être le ministre Cardy peut finir. Toute la planification qu'on a faite tout au long des dernières semaines et mois pour le retour à l'école, c'était vraiment avec l'idée que avec la pandémie, il y a toujours des choses qui peuvent changer et on savait toujours que s'il y avait de quoi qui changerait, on pourrait changer aussi en même temps avec les différentes approches qu'on peut prendre. Et le premier ministre a aussi donné des commentaires sur le fait qu'on va avoir des discussions après cette conférence de presse aussi pour discuter d'autres processus qu'on pourrait utiliser.
Enfin, non, ce n'est pas une surprise. On connaît que le virus COVID-19, en particulier le variant Delta, peut être transmis rapidement. On peut aller d'un cas à un grand nombre dans juste quelques jours. C'est ça qu'on a déjà discuté, c'est pour ça qu'on a tous nos plans en place. Et c'est pour ça qu'on a besoin d'agir rapidement en face des changements dans les circonstances. Alors, quand j'ai mentionné dans mon discours, c'était assez clair que la majorité des cas qu'on voit dans les écoles aujourd'hui c'était causé par les interactions pendant la longue fin de semaine avant que l'école était de retour la semaine passée. Mais Et alors, aujourd'hui, on connaît que le nombre de cas qu'on a, ça va augmenter. Qu'est-ce qu'on voit aujourd'hui? C'est les gens qui étaient infectés la semaine passée, la semaine après ça. Alors, c'est pour ça qu'on a besoin d'être soignés, on a besoin de prendre tous les avis de santé publique comme sérieux et d'assurer qu'on prend la protection qu'on peut prendre, et c'est d'être vacciné.
Dr. Russell would like to add before we go to our last question of the day. Dr. Russell? You wanted to add?
Oui, j'attends pour la caméra.
Okay, sorry.
C'est correct. Oui, juste pour ajouter que oui, c'est vrai que tout ce qu'on voit dans les écoles, c'est une réflexion de ce qui arrive dans la communauté. Et aussi, ce qui arrive au Nouveau-Brunswick, c'est une réflexion de ce qui arrive dans d'autres provinces au Canada. Alors, chaque fois qu'on a vu des nombres de cas augmenter dans le reste du Canada, on voyait toujours une augmentation de cas ici au Nouveau-Brunswick, mais bien plus bas, un nombre bien plus bas. Mais à ce moment-ci, c'est vraiment l'intention, quand on a fait toutes nos planifications, c'était vraiment basé sur le fait que la protection pour les enfants à l'école, ça serait vraiment avec les vaccins pour tous ceux et celles qui pourraient être vaccinés, les ados et les adultes. Alors, et aussi, on sait que la transmission de COVID et les cas de COVID, on voit la plupart du temps avec les gens qui ne sont pas vaccinés. Et si on le voit à l'école, c'est parce que les enfants ou les étudiants ou les employés l'ont apporté hors de l'école. Et on n'a pas vraiment vu de transmission entre des étudiants depuis le commencement du pandémie, vraiment. Alors, à ce moment-ci, le message, ça continue à être le même, que oui, on peut voir des augmentations de cas quand la situation dans la communauté au niveau de pourcentage le taux de vaccination peut être augmenté. C'est ça qu'on veut à ce moment-ci. On veut continuer à augmenter le taux de vaccination.
Thank you, Dr. Erica Butler, CHMA.
Hi there. I am just trying to get an idea of how many people are in the province who are choosing not to get vaccinated versus those who have just not gotten around to it yet. Now, the Premier mentioned 88% of the latest cases are not fully vaccinated. Can you give us an idea of what percentage of those cases have had no shots versus just one shot of a COVID-19 vaccine?
Well, if I understand the question properly, so we've got 12% of the population right now that do not have any vaccine of any kind. And so run around 77% of a double vaccine. So about 23% that aren't fully vaccinated. So we have currently, 12% of our population that do not have any vaccines of any kind. I'm showing.
Sorry, just to clarify my question, I'm talking about the percentage of the current cases. So you mentioned that out of the current cases, 88% are not fully vaccinated. I'm wondering if we can get a breakdown on that.
Well, in the case of current cases, so we're running 80 to 90% that are not fully vaccinated. And if you had to look at that in terms of how many are not vaccinated at all, it would be running in the 70 to 80% range, even higher, that are not vaccinated at all.
Thank you.
Okay, thanks.
Ladies and gentlemen, that concludes today's update. Thank you. Voilà la fin de notre mise à jour. Merci beaucoup.